Time now for Restoring the Soul of Healthcare from the HELPcare Clinic in Austin.
And once again, we say good morning to Dr. David Strobel and Lee Aase from the HELPcare Clinic. Gentlemen, good morning.
Hey, good morning, John.
Very good to have you with. And if we can today, I just wanted to quickly kind of go back to the topic we were talking about last week. So it was so fascinating about this service that you provide where people can get this care, and it's all part of the service that you include there. And I know it caught a lot of people's interest, and you can probably direct them to your website, because that article on your website really answers a lot of those questions. But it kind of, I want to touch on that because it showcases just how much you can actually do in this membership-based healthcare.
Yeah. So the FibroScan device is what we're talking about, and that is, it's got a fancier name, but it's basically an ultrasound technology that kind of shakes the liver and can estimate what fat is in the liver and if there's scarring in the liver.
Mm-hmm.
And of course, scarring is really bad. That's called cirrhosis. So but there's a big spectrum of that. So you get scarring early on. And if it gets bad enough, then we call it cirrhosis. And there are different levels. They call them fibrosis levels 1, 2, 3, and 4, or F1 through 4. And so then this device allows us to do that. And then there's some calculations that can be done with that information that can kind of predict what's the likelihood that this person has more advanced scarring, like a cirrhosis-type scarring, if you were to do a liver biopsy. But this allows us to kind of get an idea about, well, are you on your way towards getting more severe liver disease? And what can we do, because there's a bunch of stuff you can do prior to that to actually stop that from happening. We don't know really very much about can we reverse it, but there's ongoing research in that area, and I have some interesting thoughts on that as well, but that's kind of hypothetical. So mostly it's about catching stuff early and then doing lifestyle changes in order to prevent progression and making things really bad.
And it's kind of what I like about this whole healthcare clinic concept is that it's really about being able to be one-on-one with your healthcare provider and doing the diagnostics to really look at where you're at and hopefully preventing, but at least catching things as soon as possible and then creating a plan going forward.
Exactly.
Yeah, that's definitely it. And so it's a combination of it, because what we want to do is make sure that we have plenty of time for Dr. Dave to be with patients and to be listening to them and hearing what's going on with them. And also, he does a lot of teaching. And so that kind of relates to something else that we wanted to highlight today was some online video modules that we've done, with Dr. Dave. He explains stuff, as you just heard earlier today. He explains things better than anybody I know, from a medical professional perspective, that he's really good at, and he's got 30 years of experience in translating, complex, conditions and issues to make them understandable for patients. And so with my experience previously working in social media at Mayo Clinic, I thought this is a great thing that we should try to make this information that he's sharing one-on-one in these appointments, this educational kind of material, make that available much more broadly for people who could benefit from it. So that's something I wanted to highlight this time, and did a blog post about that earlier this week at HELPcare.health. About it's learning from Dr. Dave was the title of the blog post, and we've got so far 9 of these in-depth modules dealing on topics from acne and ADHD to feeding your new baby to balance issues that seniors have as they get older because of neuropathy in their legs. Where Dr. Dave goes into pretty significant detail in explaining what's going on. These are things that are resources for our patient members, but also for people who want to just get sort of a preview of the kind of teaching and interaction that you get as part of a healthcare clinic membership. They can go to healthcare.health and set up a free account and be able to preview some of that stuff.
Well, and as you mentioned, it's kind of more general information or broad stroke, in that if someone has additional questions, that's the time to really get in, make an appointment, and have those questions answered one-on-one.
Yeah, and doing the video modules has made it easier, because going over this over and over and over with individual patients is very, very rewarding, but it's also really time-consuming and pretty tiring. And then I also kind of forget who I've told it to, and am I just telling them the same thing again, and they're getting bored with me. So being able to have this in a kind of a video format is good. And it doesn't mean that everything about these learning modules is, exactly would I say it the exact same way every single time. So if people are confused, and one of them maybe didn't go so well, you know what? We'll probably recreate it and put a new one up that maybe explains things better. So I need people's feedback on that too.
Well, it's being able to really take control of your healthcare, in which you can, knowledge is power. So looking at that, it may answer all the questions that you would have had going in, and that gives you, Dr. Dave, the opportunity to be more specific when they do have additional questions.
Right. Like we say, the visit is never over. We're just done for now. So some of the visit you do at home by watching these things, a variety of other ways of communicating with us, but doing the learning modules, I think, is really important for everybody. I want every one of my patients to do that.
And we talk about restoring the soul of healthcare, and in a way we're sort of recreating it, being able to use all of the technologies available to us, including social media, to get people to really take ownership of their own healthcare, and then work in partnership with you to make sure we stay on that healthy path.
Yep.
Yeah, I mean, that's the idea, is that if in these videos, Dr. Dave can be covering broadly what applies to most people, but then people can, have time to, he may have talked about it in the appointment, but maybe they didn't quite catch it all, and having a chance to, dig in further and learn more. But then in the next visit to say, well, I had some questions about this, and could you explain why that's really that important? And it gets more individualized to the patient at that point.
And you envision, and obviously going forward, expanding that library of video knowledge that would be accessible to your patients.
Sure.
Right. Yeah. I mean, one of the things is, just as we produce some of these, I've been asking him, so, Dr. Dave, what are some of the things that you're talking about a lot, with patients? And so one of the ones that he did on ADHD was I thought really helpful, and he's over the years, developed this perspective that the patients find really, encouraging and helpful. But, then the one that he did on neuropathy, which is balance issues, kind of why people, as they get older, why did they shuffle a little bit, and that there's actually a really good reason for that. And then also giving some tips on how to avoid that, on how to maintain your balance, so that as you get older, maybe you don't need to do that. But anyway, it was a very I've learned a lot just from him over the years, but definitely even producing these videos, it's been great for me to have some takeaways that I apply in my own life.
We have about a minute to go here, and I just want to get people to get the information out. This is obviously membership-based. We want people to become members of the HELPcare Clinic, but it's a great way that we have so many different tools available to you, so I want people to explore it further. Let's give us your location, your phone number, your website, where people can access this information and take a little bit of control back.
Sure. First, I'd encourage them to go to helpcare.health, HELPCARE.health, and that's where they can learn about all of this, but they can come and see it in person at 308 4th Avenue Northwest. It's just a block and a half east of St. Augustine's Church, and also could call 507-279-2345. That's 279-2345. But we're open 8 to 5 Monday through Friday, 8 to noon on Saturdays. and they can stop in, and we'd be glad to show them around.
And still in that membership phase where you can get a bit of a discount on the overall membership, correct?
Right. We're early bird membership saves 20% over the regular rates, which are going into effect in June. So it's $119 a month for a single, $199 a month for a couple, $279 a month for a family, and that covers about 45 of the most common blood tests that are required, diagnostic blood tests, unlimited unhurried primary care, so that plenty of time to talk with Dr. Dave and to really be able to take charge of your own health.
And really, and I want to make this point quick, we're going to be out of time entirely, but I do want to let people know that, you're going to the HELPcare Clinic. It's not, healthcare in a vacuum. If you need something beyond, certainly the two of you would be making sure that path is followed and that you'll follow up and make sure they get the care they need.
Yes, absolutely.
Yeah, certain. Yeah, Dr. Strobel is able to refer elsewhere for special care as needed, and then also we're able to help navigate finding the best costs on some of the services like X-rays and CT scans and things like that might be needed.
All right, very good, great information as always. Appreciate that, and we will talk again next week when we get together and discuss restoring the soul of healthcare. Gentlemen, have a great week. We will talk to you next Thursday.
Thank you.
Thanks, John.
To you, John.